Juma AlAjme. So if you can please come on the dais and deliver a 5-minute address on your perspective of opportunities in healthcare and technology, sir. So can you please welcome Juma AlAjme, the Director of Digital Health Department, Ministry of Health and Prevention, UAE, sir, on the stage. Please round of applause, sir. Thank you so much for coming and taking your time from your busy schedule. I would just like to request you for your welcome address.
Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, thank you for inviting me there in this platform. And I would like to thank also the healthcare sector, especially in UAE. The last, I would say, 2 or 3 years was phenomenal. I consider this the period of the innovation, especially in healthcare sector. And I will give you history about how the healthcare started. I'll not go that far. Usually they say it's healthcare is very long, it's 10 years. So I remember when we started in UAE, when we started to adopt the EMRs. Why? Because we wanted to digitalize the medical record, especially in the healthcare facilities. And we set up standards, policies, and usually in every country there's why do we have standards, why do we have policies, why do we need to govern this? It's basically for the safety of the citizens, safety of the people, and to create this environment and harmony where everyone can work together under the, I would say, the high standard of world-class standards for the healthcare sector. And before the COVID, we oversee that we need to set up the bar on a higher level. So we introduced one policy which is called the Health ICT Law. Why? Because our country is a data-oriented country. We think about the digitalization usually because it's the future. And it was published in 2019. However, the plan for it was, I remember that law it was very important. We worked on it for 7 years. And we saw that 7 years is too much. We need to reduce this. We want to set up the bars, we want to increase. And all of these plans were before the COVID. So we introduced another policy, which is the medical liability law, in order to make sure that the insured telemedicine and telehealth is coming in the future. I remember one of the companies has approached us. They wanted to implement the telehealth within the healthcare sector. And that time we didn't have standards, and it was like something new. And how do we impose this or make it appealing for the citizen to use the telehealth? And the first NOC letter was no objection letter that you can practice the telehealth. Even before the law was there, it was in 2012, which is almost 10 years also. And then we started to work with the standards and wanted to make sure that the digitalization is increasing in the healthcare sector. And immediately the COVID hit, and the policies were there, let's put them into the practice. Now, it's by law you can practice telehealth, you can practice even, you can digitalize the healthcare sector. And last week we introduced a new policy under the remote conference that every facility within healthcare sector, they have to practice at least one service using the telehealth. So because we wanted to make sure that this is appealing, it can be increased, it can be adopted within the public and private sector, and at the same time also the citizens will adopt it more. I compare, I would say, the healthcare sector with the tourism or the food and beverage. Usually when you want to order something, immediately you have it at home. Why can't we do this within the healthcare sector? So we came up with this policy setting up standards for the telehealth. What are the, I would say, the technical infrastructure, and at the same time, what are the legal infrastructure? So what are the policies that can help you in order to produce this? And the deadline for this is almost 1 or 2 years right now. So everyone can practice. We have a great infrastructure, and we have also a policy in place in order to lift up the standards of the healthcare sector within the UAE. Now, what can we see in the future? I started this with the ChatGPT, and ChatGPT is teaching us to be lazy. So I try to write what are the challenges within the healthcare sector in UAE, and it's listed down. And I told the ChatGPT what are the solutions to do this, and immediately it answered me, try to do more collaboration, especially with the healthcare sector, whether it's public or private. And since you're doing the digitalization, I don't know, maybe it read my designation or my background. So try to invest in AI. Why? Because now even the codes that are used within the healthcare sector, whether it was ICD code or CPT code or the payers are there or the healthcare sector are there, they started to introduce telehealth and AI codes. So whether we like it or not, it's coming in the future. So I hope I set up with this speech, what are we planning to do within the future? It's a long run, but with the great, I would say, public and private sector that we have here in UAE, with this harmony, and we have done it in COVID-19, and I think we can do it also after the COVID-19 to think of the future. Thank you.